Hello and welcome to another segment of Springfield Public Schools Spotlight. Did you know that May is National Asthma and Allergies Awareness Month? And so, as you know, along with teaching and learning, there are a number of important areas of concern that Springfield Public Schools stays on top of and is very involved with in order to make sure that our students are healthy and ready to learn. So today we are joined by two special guests who are going to talk with us specifically about asthma in the classroom in Springfield Public Schools and also here in the Pioneer Valley. So please join me in welcoming our guests. We have Jean Clancy, who is the nursing supervisor for Springfield Public Schools, and also Sarita Hudson, who is the manager of the Pioneer Valley Asthma Coalition. Thank you both for joining us today.
Thank you.
Thank you.
I think I'll start my questions more broadly, talking about what asthma looks like throughout the Pioneer Valley. So Sarita, can you give us a little background about Springfield and our asthma rates?
Okay, so if we look at nationally, asthma is a real large concern for children in the whole United States. 10% of kids, 1 in 10 kids nationally have asthma. In Massachusetts, it's a little bit higher. It's 12% statewide. But in Springfield, the rates are closer to 20%. So that means that it's over a third higher here in Springfield. If you look in the rest of the Pioneer Valley, like Hampshire County, it's closer to 11%, or Franklin County around 13%. So you really see higher rates in Springfield and Holyoke and in other cities like that in Massachusetts, Lowell, Lawrence.
Now, what are the factors that contribute to that higher rate here in Springfield and cities like this?
Well, there are a number of factors that lead to development of asthma. So it's that we have older housing. Springfield's an older city, really older housing stock. 87% of homes in Springfield were built before 1978.
Yep.
If you look at the air quality, we have highways that bisect the city, 91 and 291, that go through neighborhoods, so kids are exposed to air pollution from traffic. Our school buildings are older, so there are a lot of asthma triggers just in those older school buildings. And then the Pioneer Valley, because we're a valley, we receive the airflow that comes from the Midwest, from factories and different pollutants from that way, from all the traffic and factories, and so that just lands and settles in the valley. So we have a number of factors that create asthma.
And when you explain it that way, it makes perfect sense why we would be so ripe to have those higher rates.
Right.
In addition to those sort of factors, there are some triggers that no matter where you live in the United States, you might be prone to. Can you talk a little bit about what are some of the triggers that for asthma sufferers?
Right, so there are some triggers that are just allergens like pollen. Right now it's pretty bad, so a lot of people are having allergies or asthma symptoms. But there are also things like molds, pests, so if you have cockroaches or other kinds of pests in the homes or in the schools or other buildings, those can trigger asthma. It can be chemical irritants, so it can be cleaning products. It could be the toxic fumes from factories or from, even some furniture gives us toxic fumes. It can be the cold. So there are a lot of different triggers, and what we really try to focus on are what are the ones that we can do something about.
Right.
The cold, not so much.
Right.
But there are things that we can really address in terms of environmental triggers.
And there's been a great coalition that's come together to address those kinds of things. I know it's Bay State, Springfield Public Schools, the City of Springfield, the Parks Department, Building Management Department has really come together to form a coalition to address some of these things. What is some of the work that group has been doing?
Well, the Pioneer Valley Asthma Coalition has been around since 2001, and we have been working to address asthma triggers, and we focused on working in the schools because kids with asthma are the ones who are often the sickest, going to the ER or to the hospital, are hospitalized because of asthma symptoms. And so we've been looking at where do kids spend most of their time? Well, they spend most of their time at home, and so we have a lot of programs around doing asthma home visiting and trying to support families in the homes. And then we also have programs trying to work in the schools because kids spend a third of their lives in school. And so we want to make sure that their asthma management is good, but also to reduce environmental triggers there. We've also been looking at air pollution and what are the things that we can do to reduce idling by schools, or getting all those pollutants from the cars that get sucked into the school buildings, reducing air pollution from factories and trying to avoid having a biomass plant, looking at climate change and how that is linked up with air pollution. So those are the kinds of strategies we've been looking at.
And so what the Pioneer Valley Asthma Coalition does is really acts as the expert and lends advice and direction to these other groups in terms of managing this problem locally.
That's right, and we've been very lucky to get support from the Massachusetts Department of Public Health and from the Environmental Protection Agency and from different foundations to be able to provide the resources and support to make these programs happen.
Now, I know that recently the American Lung Association awarded 2 of our schools with the Silver Award for asthma awareness. Is it asthma awareness, asthma friendly?
Asthma Friendly School Silver Champion Award.
And they were awarded to Indian Orchard and Kensington International Schools. So what is going on in those schools that is so much above and beyond what we've talked about already?
Right. Well, what's really exciting is we set up the Asthma Coalition, created the position of the school nurse asthma champion, and we have had 2 nurses step up to do this work for several years. It was started by Mary Ann Wagner at Indian Orchard Elementary, and then Ann Maggio from Kensington International became our asthma champions, which means that they learned a lot about asthma, and they shared that learning with other school nurses, with teachers, with parents, with the kids. They helped bring in different educational materials to all of those groups. They coordinate a program, and this is with support of the American Lung Association of the Northeast. We have a great health education director, Ann Otalagana, and with Elms College. And so we bring in nursing students from Elms, and they come and they do their practicum in the schools, facilitating open airways asthma self-management program. What's so cool about this is it's a community thing. We have the ALA, we have Elms, we have the nurses, and we have these kids who are learning what they can do to better control their asthma. So it really empowers them. Instead of having to feel bad about themselves having asthma, it gives them a way to learn to deal with it better. And those are lifelong skills that are going to make a difference for them as they grow up.
Great. So what I'm hearing is, while these 2 schools receive the recognition, it's not because the work lives and dies in those schools, it's because the leaders are cascading what they've learned out throughout the district.
That is absolutely true, and it's really a credit to the school nursing department, the supervision of Jeannie Clancy, and the openness of school nurses to learn about this and to take this on. And it's also the school, the Springfield Parks Buildings and Recreation Management Office. And yes, and Pat Sullivan has really taken on this idea that we need to deal with asthma triggers in the school and improve indoor air quality. One of the things that research shows is that if you have better indoor air quality, you are more alert, you have better attention skills, and we all know what that means when it comes to taking tests and to performing academically, and the research shows that you get better academic performance. And so Pat and his team, Lynn Rose, who's an environmental health consultant, has worked very closely with him to institute new environmental management procedures to deal with integrated pest management strategies so that you can reduce pests while not using the pesticides that can trigger asthma, to use green cleaning products and green furnishings and furniture that doesn't off-gas and provide more chemical irritants, and to keep the schools, procedures around how to clean the schools and maintain the school so that you don't have leaks that lead to mold, so that you don't have pests. So it's really a concerted effort by the Parks Department as well as by school custodians doing the training of the custodians so that they know how to implement this.
It's just, as you were talking, I was thinking of all of the conversations and the meetings that I've been in with different components of Springfield Public Schools and custodians immediately came to mind because of all the talk around using green products. And so sometimes you don't realize how everything comes together, but it's all working together for the greater good.
Right.
So I think that's a perfect segue to talk about what's happening inside our schools with Jean Clancy, who is the nursing supervisor. We heard from Sarita that the rates here in Springfield are among the highest asthma rates in the state. What does that mean inside our schools? How many kids are we looking at that have asthma?
Okay, we have an electronic medical record, and right now for this year, our record is showing that 21% of our students have a diagnosis of asthma, which really means 1 in 5 students in Springfield, or about 5,000 Springfield Public School students, have
That's
asthma.
prevalent.
Yes.
Those are high numbers.
It is.
Now, of those students who have asthma, is there a way that you determine if their asthma is mild or severe? Where do they fall on that scale?
Okay, so of those students, I know about 27% have medication orders in school. Nursing doesn't really use mild or severe. We considered it controlled or uncontrolled. And really, uncontrolled can happen at any time. You can get a virus and your asthma symptoms appear for 2 to 4 weeks. Or it could be the triggers that Sarita was talking about. This time of year with the pollen, all of a sudden we're seeing students that are symptomatic. What we really try to consider is the rule of 2s. If you are using your inhaler, rescue inhaler, more than 2 times in a week, or if you're up coughing or wheezing at night more than 2 times, then we would like that student to be re-seen by their pediatrician or pulmonologist, whoever manages their asthma, to see if there's maintenance medications or anything we can do to keep them more comfortable during the school day.
So you mentioned uncontrolled, and to me that sounds like it might just be sort of situational. And that's just my layman's term, is controlled those cases where you are definitely diagnosed as having asthma and you need the rule of 2s, then you are a controlled?
If it's controlled, it means you're not wheezing and you're not symptomatic.
By using medications?
You could be using, but there are some people with a diagnosis of asthma that only become symptomatic during this time of year because of pollen.
I see.
And it could be another student becomes symptomatic when they get sick. So asthma is unique to each individual student. Now you have some students that are on maintenance medications all the time.
Now for those students, how is that handled during the course of the school day if you have to have a medication for your asthma every day?
It depends upon the student. We'd like to care plan it specific to that student. Nurses always have medication in their office if we have the doctor's orders. Some students like to self-carry. So if you have an inhaler and you're old enough to use it, you know how to use it, it's really important for them to have the inhaler because they could ride the bus, they could have after-school activities, they could go to the mall with friends. So the care plan is individual for each student.
Now what are the standard guidelines or operating procedures that school nurses adhere to? Maybe training once a year or several times a year. What's the general?
Okay, so we've done a lot of training with the help of the Asthma Coalition, Dr. Sadoff. So training's not only offered to all the nurses, we actually partnered with Northeastern and Bay State to do a program online for teachers and staff. We partner with Elms College for the open airways that started in the Asthma Champion buildings with our school nurses, but that can be offered in any school in Springfield. So we've increased the training, and then we've increased partnerships with the doctors in the area. So we try to get asthma action plans on any student that has asthma that they have symptoms in school. And then we have individual health care plans for all these students that guide the care in school. So you could have a student that has to come down to the nurse every time they need to be seen, or you could have an older student that self-carries and we still check in.
So as far as parents and families go, we talked about what the role of the school and the nurses. I'm a parent. I think my child might have asthma. My child definitely has asthma. Whatever the case, what is my role as a parent?
Okay, we work closely with the parents because every year we need the parents to bring us in new orders. If by chance we don't have orders in school, the good news is we have standing orders from Dr. Sadoff, the school physician. The nurse can actually administer medication, but then the requirement is that that parent pick the child up and the child be seen by the physician. We try to have parents not use the ER, because really management is much better controlled with a pediatrician. And then we ask every year a parent to bring medication in, meet with the nurse, even the teachers. So everybody knows the plan of care. And if you've been seen during the school year, update the school if there's a change in the medication regimen at home.
It's really a team effort. It really is. It's the school, it's the community, it's the parents, and it's the student. Well, you mentioned the self-care.
Yes.
So,
Absolutely.
Speaking of that whole community effort, are there any other members of the community or organizations that have really been instrumental in this work that we haven't mentioned so far?
Well, I think it's important to highlight the Bay State Pulmonary Rehab Department and the certified asthma educators there. Michelle Hart and other certified asthma educators have been instrumental in training both the nurses, they've done community events, so they're really critical. And the American Lung Association in the Northeast, they've done some great work as well.
Great.
And we've also partnered with the Asthma and Allergy Foundation of America, so we bring in different groups to support us at different times depending on the work.
Excellent. And obviously the work of the both of you has been really instrumental in leading the charge. So thank you both for your work. And we hope that you, the audience, have learned something new about asthma, the rate of asthma here in the city of Springfield, in our Springfield Public Schools, but more importantly, what you can do as families, as members of the community to help address this issue, from making sure that your child manages their asthma correctly, to being in constant contact with the school and your physician to make sure that all of those needs are being met. May is National Asthma and Allergies Awareness Month. Thank you for joining this special segment of Springfield Public Schools Spotlight. I'm Azelle Kavan, Chief Communications Officer.